Adolescence has always been marked by increased stress and anxiety for as long as we've known. The kids seem to be living with more stress today than in the past. Why is that?
I would say it's probably a combination of stress coming out of the pandemic. There's a lot more social stress. Social media is creating a lot more stress, and there's just simply a lot of pressure to perform and be successful.
Hannah, how is social media contributing to the anxiety that Dr. Green just brought up?
Wow, I feel like the question is, how is it not? I think we are inundated from a social media standpoint with unrealistic expectations and an image from others of what they're supposed to be and how they should be acting. And it's really just something no one can live up to, nonetheless, a teen.
Brandon, I know you work a lot with adolescents, and what are you seeing as some of the more stressful indicators? Because you work really closely with a lot.
I mean, to add on to what they were saying, social media is definitely big. I think, too, for us, what I'm seeing a lot of is family trauma. Some things that may have happened when they were a childhood, but they're definitely trying to balance work, life, schoolwork, social media. They're trying to balance it all, and it's just tough for them to really manage it.
Dr. Green, with adults struggling with some of the anxiety themselves, how do they help their child with anxiety when they have it themselves?
If it's clinical or crippling anxiety, they should probably seek their own help. And if they've learned to cope, they can model how to cope effectively for their kids. They can support their children, encourage their children to push through, talk through their fears, what's most likely to happen, what's the most realistic thing, and kind of take those kind of excessive fears, kind of the false alarms that come from anxiety, and bring them down to a normal size.
What are healthy ways to manage stress?
I think that can come in a lot of different packages. And I think it's a great opportunity for parents to have conversations with their kids about ways that they think that they can do that. I think it opens the door for parents and for kids to start communicating ways that are healthy stress management, whether it's exercise or art or everything in between. It gives an opportunity for experimentation.
I always tell parents to listen to their children. I think sometimes, like with how the world is and everybody's working and everybody's busy, so you have to take that time to sit down, whether it's at the dinner table or if it's just your conversation during the day, just to make sure that your child understands how to handle it, how to manage it. But they don't need to dismiss the children's feelings. I mean, because they have a right to feel the way they feel, but just to help. But you got to listen first. That's my biggest thing. I always try to make sure I'm listening to them.
One of the best times to talk is in the car. Kids just tend to open up in the car. Other good times are going to be more the quiet times, approaching your kid, not when they're under a lot of stress, so maybe on the weekend, not during the week. And finding those quieter moments and those times when they're not distracted by something else and they have time to have a conversation.
It's hard for people to know how to get help today. And what are some ways that you can encourage people to get help, and what help is available in our community?
I know at the high school at Gainesville High, we have the hub. And so that's like a nice middle ground space. And this year's my first year with my office in there. And just to be able to see the kids being able to come in and out to receive those types of services that they may need, whether it's a mentor or, whether, a special agency is coming in to see them, it gives them that resource that they need, someone to listen to.
Can you speak a little bit more about the hub?
We offer services for mentorship, mental health clinician. Our counseling suite is right across the hallway. So we have those areas and that specific space for our kids to be able to come through and receive the resources and the help that they need. I know we have a boutique there, so if we have kids that they need clothing, their parents can come in with special reservation and wash their clothes. We have a pantry there for people to be able to get food. So it's a great resource for our community as a whole.
Is that accessible just to Gainesville High School students? Who is that accessible to?
That's accessible to our county, our entire county. So if we have families who are in the Hall County area and they need it, then they're able to do that as well.
I would add another really great resource to start with, if you don't know where to start, is reaching out to your school counselor, either as the parent or encouraging your child to reach out to their school counselor. There's a lot of useful information that the counselor can provide. Sometimes they're running groups in the school that they can put your kid in, or they may know about services that are actually available in the school that are provided by Centerpoint or one of the other organizations in town, where there are therapists coming into the schools providing services. And if you're thinking you want something more private and you don't want to reach out to a school counselor, Psychology Today is a really great website. And you can put in search terms, your zip code, your insurance provider, that will help the age of your kid who's seeking services, that will help you really hone in on a potential provider if you're seeking something more private.
And Dr. Green, I know, United Way started the One Hall United for behavioral health, and now it's called United for Health. And you've been a part of that since the beginning. What do you see them doing in the community?
A lot. I think probably the biggest thing that has taken place is the increased awareness, both awareness about mental health in general and that it is an aspect of health. It is part of being a healthy person, and connecting people to resources, connecting resources to resources. It's been a great opportunity for people from different organizations that can work we sort of say it takes a village, and it does when it comes to mental health, because somebody may need counseling, but they might also need physical therapy, or they might need occupational therapy. And so being able to connect agencies to agencies and just increasing awareness for the community about what's out there, but as well as, amongst the providers, where we can refer somebody to, maybe they need food, maybe they need substance abuse care. And not knowing where those were before, there's been a lot more information that's come about.
I want to thank y'all for sharing this helpful information on adolescence and stress. We encourage you to help spread this information by sharing this video with others. Let's reach out and check in, because together we are united around healthcare.